My name is Shofit Reg. My topic is about robotic surgery. These are the table of content. Introduction, history, what is robotic surgery, types and its application, working of robotic surgical equipment, overview of an robotic surgery equipment, Da Vinci system consists of open surgery versus robotic surgery, robotic surgical system, benefits, advantages and disadvantages, newer approaches, companies involved, conclusion and reference. Introduction. Robotic surgery is a minimally invasive surgical technique that utilizes advanced robotics and computer technologies to perform surgical procedures with precision and accuracy. And the technology involves the use of robotic arms controlled by a surgeon, which are able to perform intricate and delicate procedures with a greater precision than traditional surgery. Robotic surgery has been found to result in less blood loss, less pain, and a shorter recovery time for patients compared to traditional open surgery. The technology has been successfully used in a wide range of procedures, including urology, gynecology, cardiovascular, and gastrointestinal surgeries. And it is a minimally invasive surgery, which means procedures performed through tiny incision instead of large incisions, and it reduces or eliminate the patient's trauma while traditionally associated with open surgery. And it reduces healthcare costs by decreasing complication and reducing patient length to stay after surgery, thereby reducing hospital resources utilization and reducing risk for nosocomial infections. More than 7 million procedures have been performed utilizing robotically assisted surgical systems. And we move on to the history of robotic surgery, which has begun in 1970 as a military project done by NASA, and which uses wireless networks and robotic technologies to allow surgeons to operate on patients who are distance located. And in 1985, Puma 560, the first non-laparoscopic robot, which has introduced to perform neurological biopsies with greater precision. On 1992, they have introduced a robodog for move the femur during hip replacement surgery. Robodog, which is the first robot approved by FDA, which is Food and Drug Administration. And on 1993, the ASOP 1000, a robotic system used for holding an endoscope camera in minimally invasive laparoscopic surgery, was approved by FDA. And the ASOP 1000 was produced by the company Computer Motion. And on 2000, the Da Vinci surgical system manufactured by Intuitive Surgical became the first assisting surgical robot to get FDA approval to help surgeons to perform easier on laparoscopic surgery. And on 2003, Computer Motion merged with Intuitive Surgical, introduced the Zeus surgical system. Zeus performs the first fully endoscopic robotic surgery. And on 2009, the Da Vinci SI model has launched, which is the latest model released by Imaging System 2 HD and also allowed for a second surgeon's console, which allows for training of a less experienced surgeon. In 2014, Versier system has launched by UK by Cambridge Medical Robotics. Da Vinci Xi model has also launched by the same year 2014. On 2017, Da Vinci X system has launched. On 2018, Intuitive Surgical released its new model of robot, the Da Vinci single port platform. And on 2022, Star Robot, which is a smart tissue autonomous robot, perform gastrointestinal surgery. And the STAR robot, commonly used in robotic surgery, is called the Da Vinci surgical system. It is a robotic surgical platform that allows surgeons to perform complex procedures with greater precision, dexterity, and control than traditional surgical methods.
What is robotic surgery? Robotic surgery is carried out using mechanical arms controlled by the surgeon and bearing surgical instruments and a camera, especially to avoid the need of large incisions, and it also called robotic assisted surgery. It is a type of minimally invasive surgery that uses robotic arms to perform surgical procedures. The surgeon uses a computer console to control the robotic arms and instruments, and which are inserted into the patient's body through small incisions. The robotic arms are equipped with the surgical instruments that can rotate and bend in ways that are not possible with the traditional surgical instruments. And robotic surgery also provides several advantages over traditional surgery, including greater precision, smaller incisions, less blood loss, shorter hospital stay, and faster recovery times. Robotic surgery is commonly used for procedures such as prostate surgery, gynecologic surgery, and heart surgery. And robotic surgery has a relatively short but rapidly evolving history. The first robotic surgery was performed in 1985 when a robotic arm was used to perform a neurological biopsy. However, it wasn't until the late 1990s that the technology for robotic surgery became more widely available and began to be used for a variety of surgical procedures. One of the earliest robotic surgical system was the Da Vinci surgical system, developed by Intuitive Surgical. The Da Vinci system received FDA approval in 2000 and has since been used in over 8 million procedures worldwide. The system uses a camera and a robotic arms to perform surgical procedures through small incision, allowing for greater precision and faster recovery times. Since the introduction of the Da Vinci system, there have been many other robotic surgical systems developed for a wide range of medical specialties, including urology, gynecology, general surgery, and cardiac surgery. The technology has continued to evolve and improve, with new systems being developed that are more intuitive, less invasive, and provide greater flexibility and control of surgeons. And moving to the next slide, these are the top four robotic surgery systems. First one is Da Vinci by Intuitive Surgical. Second is Iron by Intuitive Surgical. Third one is Myco by Stryker. And fourth one is Monarch by Auris Health. Robotic surgery systems offer precise, accurate, and easily replicated results that can greatly assist surgeons and improve patients' outcome. The term robotic surgery is often viewed as an autonomous robot completing the procedure without human interaction. However, it is important to note this is not the case in most systems. Robotic systems are guided by professional certified surgeons to facilitate the procedure being conducted. These systems are proliferating rapidly as of recent, and the Food and Drug Administration is clearing more each year. By Intuitive Surgical, which is the first robotic surgery master slave device, gained FDA clearance in 2000 for laparoscopic surgery, allows surgeon to perform various minimally invasive procedures with a clinically supported precision and accuracy. The surgeon operates via surgeon console, that is called master, that controls the patient's side card, that is called slave, robotic devices including various surgical instruments and a camera. That is, in 2000, Intuitive's Da Vinci surgical system was the first robotic surgery device to gain FDA clearance for use in general laparoscopic surgeries. The Da Vinci surgical system allows surgeons to perform various minimally invasive procedures with clinically supported precision and accuracy. The system applies to a wide area of operations including minimally invasive, cardiac, colorectal, gynecology, head and neck, thoracic, urology, and general surgeries. The surgeon operates via the surgeon console that control the patient's side card robotic devices, including various surgical instruments and a camera. Over 1,700 Da Vinci systems are currently installed in hospital internationally, and more than 775,000 patients have received procedures from this robotic surgical system, with roughly 75% of all prostate cancer operations in the US being performed using Da Vinci surgical devices. This robot Perform has established itself as an effective and reliable tool. And the Da Vinci surgical system provides the surgeon with precision, dexterity, and control during surgery. The ability to execute 1 to 2 centimeter incision versus longer incisions. The Da Vinci surgical system consists of an ergonomically designed surgeon console, a patient cart with 4 interactive robotic arms, a high-performance vision system, and patented Endovis instruments. And it also including minimally invasive surgeries like cardiac, colorectal, gynecology, head and neck, thoracic, urology and general surgeries. And the next one is iron by intuitive surgical. The intuitive iron endoluminal system received clearance from the Food and Drug Administration in February 2019. The iron endoluminal system is a robotic-assisted platform for minimally invasive biopsies of peripheral lung lesions, manufactured by Intuitive Surgical. This American corporation is based in Sunnyvale, California, which mainly designs, develops and markets robotic-assisted products aimed to enhance outcome of minimally invasive surgery procedures. The iron endoluminal system includes the PlanPoint software platform, which generates 3D images of the patient's airway from a conventional CT scan of the chest, identifying boundaries and location of critical structures. The user can pre-plan a path for the nodule biopsy and can export it to a USB flash drive. During the bronchoscopy procedure, the clinician uses the IONS controller to navigate along the pre-planned path. The bronchoscope catheter is 3.5 mm in diameter with a 2 mm working channel. It accurates 180 in any direction and can reach any lung segment. The system provides real-time vision of the airway throughout navigation and calculates the shape of the catheter hundreds of times per second. Once the lesson is reached, the bronchoscopy catheter is locked in place and the biopsy needle is deployed onto the target on a straight path. The system has a biopsy marker feature that allows a user to visualize multiple needle trajectories and track multiple biopsy attempts. The platform has not been marketed for human use outside of the US. The manufacturer reports that the risks associated with the procedure are similar to those associated with the conventional bronchoscopy performed through an endotracheal tube under general anesthesia. Although overall risk is low, serious complications can occur. And the next one is Myco by Striker. Myco enables you to have a more predictable surgical experience when performing joint replacement surgery. Robotics assisted surgical devices offer partial knee, total hip, and total knee operations. Myco protects soft tissue and ligaments from damage. And Mako can be used for total hip replacement, which is procedure designed for patients who suffer from non-inflammatory or inflammatory degenerative joint disease of the hip. The Mako technology provides the surgeon with a patient-specific 3D model to pre-plan the patient's hip replacement. During surgery, the surgeon gets the striker robotic arm based on each patient's specific plan. This helps the surgeons to focus on removal of diseased bone, helping preserve healthy bone, and assist the surgeon in positioning the total hip implant based on patient's anatomy. And the working of Myco by Striker, the first one is personalized plan. All it begins with a CT scan of the patient's joint that is used to generate a 3D virtual model of your patient's unique anatomy. This virtual model is loaded into the Microsoft system software and is used to create the patient's personalized pre-operative plan. And the next one is in the operating room. During surgery, the surgeon guides the robotic arm while preparing the hip socket and positioning the implant based on the patient's personalized preoperative plan. The macro system also allows the surgeon to make adjustments to the patient's plan during surgery as needed. When the surgeon prepares the bone for the implant, the microsystem guides the surgeon within the predefined area and helps prevent the surgeon from moving outside the planned boundaries. This helps provide more accurate placement and alignment of the implant to plan. And the third one is after surgery. After surgery, the surgeon, the nurses, and physical therapists will set goals with the patient to get the patient back on the move. They will closely monitor patient's condition and progress. The surgeon may review an X-ray of the new hip with the replacement. The fourth one is Monarch by Auris Health. It is a bronchoscopy device to detect lung cancer for lung-related diseases. It has received clearance from FDA on 2018. The robotic-assisted system incorporates a flexible robotic endoscope throughout the lungs. And Auris Health bronchoscopic device, the Monarch system, has received clearance from FDA in 2018 March. The robotics assisted system incorporates a video game-like controller into the procedure, with the surgeon using it to navigate a flexible robotic endoscope throughout the branches of the lungs, offering continuous bronchoscope vision, computed guidance, and precise control of instruments. The system offers an innovative new technology to perform lung endoscopic procedures. It also aggregates the traditional endoscopy viewpoints with computer-guided navigation based on 3D models unique to the patient. And with the new urological clearance, doctors will be able to use the surgical robot to snake an endoscope into the kidney to break up and section out kidney stones, with an attached camera providing a real-time view of the area the whole time. Monarch has been proven especially useful in nephrolectotomy procedures to remove kidney stones or PNCL, which reach the stone through a small incision in the patient's back. Through this method is highly effective at removing larger stones. It is more difficult to perform than the widely used urethroscopic method, which sends a scope through the urethra and bladder to reach the stone. With Monarch's help, however, surgeons can use a video game-like controller to send the endoscope safely through the skin to the kidneys and remove broken up kidney stones and any additional fragments with greater precision. The system can also be used in urethroscopic procedures to remove smaller stones. And Monarch reduces the complexity of gaining high-quality access and aids stone clearance efficiency through simultaneous fragmentation and suctioning of stones with robotic assistance. And with this platform, many urologists may be willing to expand their practice to include percutaneous access and PCNL procedures, thereby increasing patients' access to more effective treatment closer to home. And move on to the working of the system, there may be different robotic surgery procedures. The robotic technology allows the surgeon hand movements to be translated into smaller, more precise movements of tiny instruments inside the patient's body, making this procedure less invasive and more accurate than traditional surgery. The most common is based on master-slave teleoperation system with 6 degrees of freedom, which the surgeon will be seated at a unique console with hand and foot controls that enable them to accurately and remotely operate surgical instruments coupled to robotic arms. Adjustments can be also made to change the scale of robot's movements. A small 3D endoscope camera is inserted into the patient through a very small incision, which gives them a magnified 360-degree view of the operative field on a high-definition monitor that essentially places them inside the patient. Robotic surgical systems are advanced medical devices that are used by surgeons to perform minimally invasive surgical procedures. This system consists of a robotic arm that holds surgical instruments, a camera arm that provides a high-definition 3D view of surgical site, and a console where the surgeon sits and controls the robotic arm using hand and foot pedals. Here is a brief overview of how robotic surgical system works. First one is preparation. Before the surgery, the patient is prepared by cleaning and sterilizing the surgical site. Robotic arms are also cleaned and sterilized, and the surgical instruments are loaded onto the robotic arm. Second is anesthesia. The patient is given anesthesia to make them unconscious or numb during the surgery. Third is incision. The surgeon makes small incision in patient's body to access the surgical site. Fourth is insertion of robotic arms. The robotic arms are inserted through the incision and positioned at the surgical site. So fifth one is console setup. The surgeon sits at the console and uses hand and foot pedals to control the robotic arms. Sixth one is imaging. The camera arm provides a high-definition 3D view of the surgical site which the surgeon can view on the console. The seventh one is surgery. The surgeon uses the hand and foot pedals to control the robotic arms and perform the surgical procedure. The surgeon's movements are translated into precise movements of the surgical instruments by the robotic arms. And the eighth one is completion of surgery. Once the surgery is complete, surgical instruments are moved and the robotic arms are taken out of the patient's body. The ninth one is closure. The incisions are closed using stitches or staples and the patient is monitored during the recovery period. Robotic surgical system offer many benefits over traditional operation open surgery, including small incisions, less pain, fast recovery, and reduced scarring. However, they also require specialized training and can be more expensive than traditional surgery. And this is an overview of a robotic surgery equipment. The Da Vinci system is a remarkable improvement over conventional laparoscopy, in which the surgeon operates while standing and uses handheld, long-shafted instruments that cannot bend or rotate. With conventional laparoscopy, the surgeon must look up and the way from the instruments to a nearby 2D video monitor to see an image of the target anatomy. The surgeon must also rely on his patient side assistant to position the camera correctly. In contrast, the Da Vinci system ergonomic design allows the surgeon to operate from a comfortable seated position at the console, with eyes and hands positioned in line with the instruments. To move the instruments or to reposition the camera, the surgeon simply moves his or her hands. By improving surgeons with superior vision, enhanced dexterity, greater precision and ergonomic comfort, the Da Vinci surgical system makes it possible for more surgeons to perform minimally invasive procedures involving complex and delicate dissection or reconstruction. The robotic surgical equipment typically includes three main components: the surgeon console, the patient cart, and the vision cart. The console. This is where the surgeon sits during the surgery and controls robotic arms and instruments. The console usually has a display screen and hand and foot controls that allows the surgeon to manipulate the instruments with precision. The next one is the patient side cart. This is a separate cart that holds the robotic arms and instruments that are used during the surgery. This is cart is positioned next to the patient on the operating table. The third one is vision card. The component provides the surgeon with a high-resolution 3D image of the surgical site. The vision system can also magnify the surgical field, allowing the surgeon to see small details more clearly. In addition to these three main components, robotic surgical equipment may also include specialized instruments and tools designed for specific types of surgeries. For example, a robotic surgical systems used for prostate surgery may include special instrument that allows the surgeon to remove the prostate gland with greater precision. Robotic surgical equipment can vary in size and complexity depending on the specific system and the types of surgeries it is designed to perform. Some systems are large and require a dedicated operating room, while others are more portable and can be used in variety of clinical settings. The cost of robotic surgical equipment can also vary widely, with some systems costing several million dollars. As we said earlier, the surgeon console, where the surgeon sits to control the instruments while viewing the patient's anatomy in high definition 3D through a stereo image viewer. The instruments are rested and move like a human hand, but with a far greater range of motion. The next one is patient cart. Positioned near the patient on the operating table, the patient cart holds the endoscope and instruments that move in real time in response to the surgeon's control from the console. And the third one is vision card. The vision card makes communication between components of the system possible and supports the 3D high definition vision system. Open surgery versus robotic surgery. In open surgery, there is only a single long incision, and on robotic surgery, several small incisions are needed. On open surgery, longer stay in hospital and it take longer healing period. But in robotic surgery, it only take shorter hospital stay and it has a speedy recovery time. On open surgery, it carry a lot of health deteriorating risk. In robotic surgery, no life endangering risk involved. Here shows the system level block diagram of a robotic surgical system, and it consists of master console and a slave console. Both the master console and the slave console are connected via RS-485 standard interference communication link. The main reason for choosing the RS-485 bus standard is in the fact that it is one of the most widely used communication highway in industrial and instrumentation applications. Thus, the differential transmission ability of RS-485 increases noise immunity and ensures a reliable link. The long-distance bidirectional communication over a single pair of twisted cables make it more feasible. It also allows multiple transmitters and receivers to be connected on a single bus in the master-slave topology. The master control and sensing module in the master console receives command instruction from the surgeon and send it to the slave console in a well-defined form. Similarly, the slave control and sensing module in the slave console is responsible for driving the sensing module in a controlled fashion, which imitates the surgeon's hand movements. The system also comprises of an independent integral system power module, which is responsible for power distribution of the whole system. Robotic surgery is a type of minimally invasive surgery that utilizes advanced robotic systems to assist surgeons in performing surgical procedures. Here are some of the benefits of robotic surgery: smaller scars, shorter hospitalization time, lower risk for adverse side effect, faster overall recovery time, less pain, no blood donation prior to surgery, less blood loss, quicker return to normal activity. The robotic surgery enables surgeon to make more precise incisions and movements during surgery due to the enhanced visualization and advanced instruments. And the second one is reduced blood loss. The use of robotic surgery can lead to less blood loss compared to traditional open surgery, which can reduce the need for blood transfusions. Smaller incisions. Robotic surgery requires only small incision, resulting in less scarring and a quicker recovery time for patients. And faster recovery. Robotic surgery is less invasive than traditional open surgery, which means that patients experience less pain and can return to their normal activities faster. And reduced risk of infection. Because of robotic surgery requires smaller incision, the risk of infection is significantly reduced compared to traditional open surgery. And reduced hospital stay. Patients undergoing robotic surgery typically have shorter hospital stays compared to patients who undergo traditional open surgery, and fewer complications. Robotic surgery has been shown to result in fewer complications compared to traditional open surgery. Overall, robotic surgery offers numerous benefits for patients, including reduced pain, faster recovery, and improved outcomes. And move on to the advantages. The surgeon have a better view of what is happening during the operation, which enables them to see better. Always means less tissue damage for patient, which helps in fast recovery. Fewer chance of getting infection, more precise compared to traditional surgery, and greater precision. The robotic arm's movements are more exact than a human hand, and their range of motion is greater. The arms rotate instrument in tight spaces in ways they aren't otherwise possible, and better visualization. A sophisticated camera provides magnified, high-definition view of a surgical area. It also has 3D capabilities of imaging that are superior to naked eye, ability to do surgery inside the body. The small instruments allow surgeons to perform steps of the operation inside your body when traditionally they would have had to make a much larger incision to do that part of procedure outside of your body. And move on to the disadvantages. Touch absence, cost, system maintaining, procedure time, device malfunction or failure, more studies needed. The cost. Robotic surgery is generally more expensive than traditional surgery due to high cost of robotic systems and the need for specialized training for surgeons and support staff. Learning curve. The use of robotic technology in surgery requires specialized training for surgeons, which can result in a longer learning curve compared to traditional surgery. Technical issues. Like any technology, robotic system can experience technical issues or malfunctions, which can result in delay or the need for additional procedures. And limited availability. Not all hospitals or surgical centers have the resources or expertise to offer robotic surgery, which can limit access for some patients. Lack of haptic feedback. Robotic surgery does not allow for the same level of tactile feedback that surgeons have during traditional surgery, which can make it more difficult to assess tissue texture and other factors. Reduced range of motion. While robotic surgery provides enhanced precision and control, the robotic arms may have a more limited range of motion compared to human hands, which can make certain procedures more challenging. Overall, while robotic surgery has many advantages, it is important to consider the potential drawbacks and limitations when evaluating the option for surgical procedures. And move on to the newer approaches in robotic surgery. First one is nodes. Such advancements also bring natural orifice transluminal endoscopic surgery nearer, where surgery can be truly non-invasive by helping to achieve greater stability of instruments despite their flexibility, allow sufficient forces to be applied for traction and large organ retraction. Proper positioning of the instruments, greater dexterity and image quality. The next one is miniature in vivo robots. Miniature in vivo robots developed by Virtual Incision and Center for Advanced Surgical Technology are a novel approach with the whole MIS surgical platform being inserted into the peritoneal cavity. These have two arms with multiple functionalities, with several joints for unlimited flexibility. With a minute entry incision, miniature motors driving the arms, and a high degree of flexibility. This offers careless surgery and can be used by inexperienced surgeons under the mentorship of veterans, highly expanding patient access. These robots allow surgeons to image the surgical site from many angles and to complete the surgical task on site or remotely. These are inexpensive and easily transportable, allowing minimally invasive surgery to be done anytime, anywhere, by almost anyone, from outer space, the battlefields, or remote medical emergency situations. The third one is capsule robots. These are miniaturized endoscopes that can be used in many diagnostic tests, surgeries, or for drug delivery. They can be manipulated via magnetic interactions, allowing for an untethered design with enormous freedom of movement, and are extremely small, causing less tissue damage and fast accessibility. Fourth one is microbots. Microbots, though far in future, are a potential advancement which do not require any incision at all, but could be introduced into a circulation and transported to a specific destination. And microbots are very different from the earlier master-slave systems, without physical connection to the operator, with much greater access and with the potential for content propulsion, consistent imaging, accuracy of tele-manipulation, and miniaturized functionality. When these issues are addressed, microbots could revolutionize surgeries. These are the companies involved: Intuitive, CMR Surgical, Corindus, Hansen Medical, Medical Micro Instruments, Transcentrix. The Intuitive Surgical. The Intuitive Surgical stood firm on the leading position in the United States robotic surgery market in 2018. It got FDA approval for its first historical robotic system, Da Vinci, in 2000. And from that point forward, they have developed the Da Vinci framework to yield a robotic surgery empire. Other Da Vinci systems, for example, the Da Vinci S, were marketed in 2006 and the Da Vinci Si in 2009, yet Intuitive's leader product. The Da Vinci Xi was presented in 2014. Intuitive Surgical will still be the leader by a huge edge for a considerable number of years, powered by revenue from its surgeries, services and maintenance fees. CMR Surgical. CMR Surgical is a British organization building the cutting-edge careful surgical robotic system versus for minimal access medical surgery. Their vision is to make minimal invasive medical surgery universal, that is easily accessible and affordable. CMR Surgical, established in 2014, it has headquarters in Cambridge and got the European CE mark in March 2019 for the Versia surgical robotic system. Corundus Corpath 200 device is intended for percutaneous coronary medications. The Corpath accompanies a radiation-protected cockpit for the surgeon. The Corpath 200 is the first and only robotic-assisted procedure to take into account controlled placement for coronary guideways and send swell catheters from an optimized interventional cockpit. It utilizing the framework, the surgeon works Corpa 200 from behind a radiation protected cockpit rather than being with a patient while clad in a lead apron. The surgeon is situated behind an operating station controlling surgical devices with a range of touchscreen and joystick controls. Hansen Medical. The Mountain View based organization robotic catheter is intended to explore the peripheral vasculature and give and conduct for the arrangement of therapeutic devices. The catheter works as a component of Hansen's malignant robot system. The Sensei X robotic system utilizes 3D catheter controls and 3D visualization to permit a surgeon to control its robotically steerable catheters for gathering electrophysiological information inside the heart atria. And medical micro instruments. Medical micro instruments founded on 2016 in Calcai, Italy. Robotic platform using micro instruments for surgery. Mimic Surgery, founded on 2013 in Israel, provider of a robotic surgical system with humanoid type articulated arms, which can be controlled by a proprietary console. The firm is positioning the robot initially for laparoscopic procedures. And these are the reference. Thank you.